This is still your nursing assistant. I'm here to help you with your catheter care. Are you okay with that? Jesus says, yep. Sanitize my hands. Rub it all over until it's dry. I gather my supplies. 2 pairs of gloves. 3 washcloths. A big towel. Soap and basin. I'm going to wear my first pair of gloves right away to grab the basin. Never touch these containers with your bare hands. Wear your gloves. The reason I'm grabbing the container last, so that it reminds me to stop by the bathroom to get water. You have to fetch water and test the water temperature. Come into the bathroom, fetch warm water, test the temperature using my elbow. We talk about that in the classroom. Hey Hazel, can you please test the water temperature? Allow the resident to test the water temperature. What's comfortable for you could be uncomfortable for the next person. Provide privacy and take away the call light. Raise the bed up for good body mechanics. Move through your pre-steps really fast and your post-steps as well. Hazel, I'm going to lower the head of your bed, okay? Good. I'm going to uncover you, Hazel. I uncover Hazel from her feet all the way up to her waist. Right there. Grab the waterproof pad. The state examiner will already have a pad there for you. That's how nice they are. They do not want you to run out of time. So they will place this under there already. All you have to do at the end of the scale, ask them whether you want them to have this there or you should remove it. But they will have one there for you. But in the meantime, cross the legs, extend the arm, give her a hug, and call the examiner's attention to place the pad. We did that for bedpan. Just say, examiner, cross the legs, extend the arm to remind you of these steps. But no one has to come for you to turn them on their side. Just use that as a caution to remind you, class. Because to place this pad, you have to cross the legs, extend the arm, give them a hug, a dependent person to turn them and put this pad. You can't do the legs like I just did to lift it up like that on a real human being. So it's going to remind you to remember the steps. I'm going to cover her feet all the way up to her knees and just leave this part exposed that I'm going to be working with. Take the first washcloth and put it in the water and apply soap onto it. I want you all to come further so that you can see how we'll be doing this. I'll get some of the water out of the towel, apply soap onto the towel, and fold the towel into 4 equal parts. You see this part of the catheter tubing that is entering her body? That's the meatus. I'm going to grab the catheter tubing at the meatus, right there. You can't come up like this. You can't do that. You can't do that. It has to be right there. Wrap the towel around the tube and wash 4 inches away. No pulling or tugging. Turn the towel around to another clean spot. Grab the catheter or hold the catheter at the meatus and wash again. 4 inches. No pulling or tugging. Put this in the dirty linen basket. Grab the second towel for rinsing. No soap. Get some of the water out again. Fold the towel into 4 equal parts. Hold the catheter at the meatus in a circular motion, 4 inches. No pulling or tugging. Switch the towel around to another clean spot and rinse for the second time. Put that in the dirty linen basket. Grab the dry piece of washcloth and pat dry. Put all of these into the dirty linen basket. Remove the pad and put that in the dirty linen basket. And change my gloves right away. The gloves are dirty. Gloves to gloves. Skin to skin. Sanitize my hands quickly. Hands become sweaty in gloves. Just sanitize your hands so that you're not touching things with your sweaty hands out of the gloves. Make it so comfortable. These are your post-steps now. Move through them real fast. Bring her head up so she will continue to watch her TV Lower her bed down for safety. Open the privacy curtain. Give her back her call light. Hazel, is there anything else you want me to take care of now? She says, nope. Grab all these containers and go straight into the bathroom for cleaning. I dump the water in the toilet. I wash the container, rinse the container, dry the container, take it back to where it belongs. The examiner will show you an area in the skill room to return your supplies. Take them there. Go back in the bathroom and take off my gloves. Glove to gloves. Skin to skin. This is a mandatory skill. Open the faucet, check the temperature, make sure uniform not touching the sink. Wet my hands, apply soap. Lather the soap on all surfaces of the hands and scrub for 20 seconds. All parts of the hands, between the fingers, my thumbs, the back of the hands and fingers for 20 seconds. My wrist, fingertips, to clean my nail beds by rubbing in each palm. Rinse. I'll be careful not to touch any part of the sink so that I don't recontaminate my hands. Allow the hands to drip for a few seconds. Grab paper towel and dry from the fingertips to the wrist. Trash it. Another paper towel, fingertips to the wrist. Trash the paper towel. Switch my hand. Grab another paper towel from the fingertips to the wrist. I trash. Fingertips to the wrist. I trash. Grab one last clean one and shut the faucet. Done. Catheter care. Any questions?